Hello, everyone. My name is Leslie Burry. I'm Director of Admission for Research College of Nursing. My role at Research College of Nursing is to assist our BSN and MSN students through the admission process, help them with the financial aid process, all the way up through the registration process. The presentation that we developed today, Pathways to Nursing, is really to help you know what options are available to students. So when that student comes in and says, I want to be a nurse, you'll have some tools to talk to them about what some of the options are to gain that career path. Many of you may know, but there are over 3 million registered nurses in the United States. The projected growth by 2030 is for an additional 9%. So over 275,000 more nurses are going to be needed in the next 9 years. In Kansas City alone, on any given day, there are approximately 1,500 open nursing positions. And certainly for those of us that live in Kansas City, we'd like to see those positions filled because we'd like to know that our hospitals are well staffed. So there are several education paths that you can take. When students think about being a nurse, I think many of them are thinking about, I want to be a registered nurse. I want to do an RN program. What I always want students to understand is that RN is not a degree. RN is a license. There are associate degree nursing programs and bachelor degree nursing programs. Both of them allow a student to sit for the NCLEX, and assuming you pass, you will be a registered nurse. So the students need to do either an associate degree or a bachelor's degree nursing program, sit for the NCLEX, be successful on the NCLEX, and then they are a registered nurse. So finding a way so students understand the difference between the ADN and the BSN. The average pass rate in the United States is about 86.5%. So I hope that gives you assurance that nurses are well prepared and able to take care of all of us. So the first pathway I want to talk about is the CNA, the Certified Nursing Assistant. So that is a program that requires a high school diploma or GED. The average starting income is about $28,000. I think I did the math, and that is maybe about $15 an hour. I know we have students we have people listening here from all over the state. So I would encourage you to possibly call some of your local nursing homes and ask them what the starting salary is. Most CNA programs are about 4 to 12 weeks. You do want to make sure that you have a state approved program, so that way you're going to be eligible to take that certification exam. It's about 75 hours of theory and 100 hours of clinical training. There are some associate degree nursing programs that require a CNA. So they would like students to come to their program having that certified nursing assistant already. So students that are interested in that may want to look at those ADN programs to see if that is something they should do before they come. It can be a great part-time job for a student who's working on prerequisites to go to nursing school. It can also help with some of the anxiety that students feel when they get into a nursing program, if they've already done some of those skills or if they've worked as a CNA. You're going to find most of your CNAs in nursing homes, long-term care facilities, and home health. The LPN is the licensed practical nurse. Again, high school diploma or GED required. There are a few prerequisites required for some LPN programs, not very many, but students can certainly contact the LPN programs in their area to find out what, if any, prerequisites are required. LPN is typically completed in 12 to 15 months. Sometimes a 2-year associate degree program might be available for students. And then there's also an NCLEX exam for the LPN. You're going to find most LPNs in doctor's offices. There may be a few in some of those long-term care facilities, but a lot of them are doing private practice. I mentioned the ADN, that stands for Associate's Degree in Nursing. Most of your associate degrees are going to be at the community college level. As I mentioned earlier, students are eligible to sit for the NCLEX exam, and when they pass, they are a registered nurse with an associate's degree in nursing. The difference between associate's degree and bachelor's degree is typically in the prerequisites. So students might do 1 year of prerequisites and a 2-year ADN program for a total of 3. For a BSN, they're probably looking at 2 years. The average starting salary in Kansas City right now for a new RN is about $50,000 a year. So certainly it's a nice starting salary for students right out of college. You can then pursue a BSN or even an MSN in a bridge program. There are many of those across the country. Many of those are online, and students can finish that BSN or MSN in one of those bridge programs. Many hospitals are still hiring ADNs because, again, we have a nursing shortage. So everybody needs registered nurses. They usually do require that you pursue that BSN within 5 years of starting employment. The Bachelor of Science in Nursing is what I think most students are going to be most familiar with, because those are the 4-year programs. Those are the programs where you can go to MU or William Jewell or in some of those other programs and Research College of Nursing to get that BSN. You sit for the NCLEX. When you pass, you're a registered nurse. Starting salary is the same. So an ADN prepared RN and a BSN prepared RN is going to make the same amount of money right out of their program. Again, the ADN nurse is probably going to have to go back and pursue that BSN fairly soon, but they're going to make the same amount of money. Those programs are usually 4 to 5 years. If a student does it in a traditional 2 years of prerequisites and 2 years of nursing, it's going to be 4 years. If they want to look at an accelerated BSN, those are typically 1 year following completion of a non-nursing bachelor's degree. So then that's going to be 5 years from start to finish. MSN and DNP. So a lot of students come to me and the first thing they say is, I want to be a nurse practitioner. So they're right out of high school, but they're very anxious for that to be their end goal. So there are a number of specialty areas. Research College of Nursing has a family nurse practitioner, but there are pediatric nurse practitioners in mental health and women's health. There's also nurse educator programs if you want to teach. There are executive leadership programs if you'd like to be a chief nursing officer or a CNO. The MSN DNPs are going to offer you autonomy, flexibility, and some financial rewards. I think a nurse practitioner in the greater Kansas City area is probably going to make $100,000 to $120,000 in a private practice. So certainly there's some financial rewards. The DNP is the Doctorate of Nursing Practice. That's what many FNP or family nurse practitioner programs have gone to. And that's just something that gives students a little bit more practice hours for that advanced degree. Students oftentimes will ask, so I live in Kansas or I live in Illinois, but I'm going to nursing school in Missouri. So how is that going to work? You can do a single state license. So you can, if you live in Kansas, you can apply to take the NCLEX in Kansas. If you live in Illinois, you can take that test in Illinois. And so you would have a single state license. Nowadays, there's not a lot of reason for a single state license because most students in the Midwest will do the compact. So the compact license covers a number of states and allows students to practice in all of the states that are in that compact. So this is popular in Kansas City and St. Louis because we do have hospital systems on the Kansas City, Kansas and Kansas City, Missouri sides. and those hospitals want students to be licensed in both states. And the same happens in St. Louis, being so close to the Illinois state line. So it's many of those hospital systems want the students to be able to cross state lines and practice as a nurse. The only thing that students need to know is they do take the licensure in the state they reside. So if you reside in Missouri, you're going to take the Missouri compact, but then again, you can go practice in Kansas. So some of the things that that I feel like my many years of nursing admission experience have led me is do talk to students, whether those are high school students or those students who are starting college, to really pursue those math and science courses. Those can be really important foundational courses. Chemistry still intimidates a lot of nursing students, but if they've had a high school chemistry course, at least they know what a periodic table is and they've done some of the equations and they might not be quite so intimidated by it. So really encourage your students to take as much math and lab science as possible. Traditional BSN recommended for traditional high school students. What I mean by that is if you've got an 18-year-old that wants to be a nurse, and they're a good student and they have the ability or the opportunity to do a four-year college degree, really encourage them to do that. The pathway to doing nursing as a career ladder, and I'll talk about that in a second, it will take longer. So really encourage students to look at those four-year BSN programs and pursue that. Do be wary of technical and vocational schools. I'm sure there are a lot of them that offer great opportunities for students, but if they are accredited as a technical or vocational school, there's a really good chance that college credit is not going to be accepted by 2- and 4-year universities. So they do need that regional accreditation, that HLC or that HLC accreditation, something so that credit can be transferred. I mentioned accelerated BSN a little bit earlier. That's a 1-year program for students who have a 4-year bachelor's degree. I have often worked with college athletes who have looked at this as a great opportunity. It can sometimes be very challenging for a student to be a 4-year athlete, varsity athlete, and a nursing student. The clinicals conflict a lot with practice and game schedules, and neither faculty or coaches are really wanting to give a lot. So if you have an athlete who wants to go play for 4 years, but really wants to be a nurse, encourage them to look at our accelerated nursing program as an option to get that done. I mentioned that career ladder. We often talk to students about this. If you have students who are young parents and are looking for something that's going to allow them to increase their salary along the way, really do shorter programs and have the benefit of improving their work environment, maybe their financial status each way, they can do a CNA, an LPN, an ADN, and a BSN. Now, this may take them a little longer. I mentioned that earlier. This could take a few years, but a lot of LPN programs will give a little bit of credit for a CNA. ADN programs will often waive the first year of the ADN program and allow an LPN to come in and finish the second year, sit for NCLEX, become a registered nurse. And then there's many ADN to BSN bridge programs that are online. A lot of those are a year, maybe a year and a half, and give students that opportunity to have that BSN. And then what I didn't include on here certainly is the opportunity to go on for an MSN or DNP at the end for that. So I'm going to turn this over to Susan, and I will let her introduce herself and tell you a little bit about opportunities at Research College of Nursing.
Hi, everybody. My name is Susan Arnold Christian, and I am our student recruitment coordinator here at Research College of Nursing. So for you high school teachers and counselors, I am a great first kind of step as your students are exploring before they are ready to do an application. My role is really to help students progress, get to the application process, and then once they get to the application process, that's where Leslie comes in and helps them through that process. But I want to talk with you a little bit about our programs here at Research College of Nursing. So why should your students consider us as a school? We're here in Kansas City, right kind of in the heart of the city. If you're familiar at all with Kansas City area, we are very close to the Kansas City Zoo. But our students do very, very well. We've been doing these programs for over 115 years, and the only thing that we do is nursing. So we offer a bachelor's degree and master's degree in nursing. Our students sit for the NCLEX and pass at the first time at a rate of 94%. And you heard Leslie earlier say that the national average is around 86%. So our students are doing very, very well on their NCLEX exam. They are 100% degree employed in the field. And so they are getting jobs as nurses. And we also have a great program through HCA Midwest that has a number of Kansas City hospitals where students can work for them for 2 years and get 90% of their tuition supported and paid for. We can talk about that a little bit more later. We also have a very low faculty student ratio. We are a small school, so it's about 13-to-1 faculty to student ratio. And what I've loved about being here is just the people. The people really want to see students succeed. And so everything that we do is about how to make this process easier for our students. We are also accredited by the Higher Learning Commission and CCNE, and we are owned by HCA Midwest Health. This are the areas where you can see the HCA hospitals in the Kansas City area. And one way that this demonstrates to our students is through the clinical experience. So our clinical experiences are dedicated education units, and they're each of these Kansas City HCA hospitals, as well as our pediatrics being done at Children's Mercy. But when our students go to their clinicals, to their dedicated education unit experiences, they are paired one-on-one with a nurse to shadow and observe for the day and work with them. And those nurses are trained by our faculty to help evaluate the students and give feedback. If you go to our YouTube channel and just look up Research College of Nursing on YouTube, you can see some of our student stories and experiences about this unique type of clinical experience. Traditional clinicals are, a group of 6 or 8 students following a faculty member around for the day and just kind of observing. But our students really get the opportunity to one-on-one be paired with a nurse for their clinical experiences and get more of a deep dive into that experience. As your students are looking at doing their prerequisite courses, we are considered kind of a 2+2 program, so they can go anywhere they want for their first 2 years of college, their freshman year and their sophomore year, take this list of prerequisites right here, and then transfer to us for their junior and their senior year. So they can take these at any accredited college. And Leslie talked a little bit about kind of what we're looking for in that accreditation process, but they can go to a college like a Metropolitan Community College or a Kansas State University, wherever they want to go. And we talk with students about how to be successful in that and how to transition through that process and what some of these things, like what it typically means to have a credit hour and how much work outside of class you have to do to be successful in these courses. But this is the list of prerequisites that we're looking for in their freshman and their sophomore year of college. We do have an early admission process for high school seniors and college freshmen. And so as they're a high school senior, they can actually apply. That's a no cost, no essay to write, not binding decision. And they can apply and get a spot held for them while they go take those first 2 years of prerequisites and explore and kind of make sure that that's the right fit for them. What we're looking for in the application I'll talk about in just a second, but they will actually receive a written letter of admission while they're in high school confirming that they have that spot held for them. And the application is just linked on our website. It's a PDF form that students download and email to us or send to us. and then just have their high school transcripts and ACT scores sent directly to the college so we can make that decision. But I kind of call this to students kind of a no-brainer approach if you're at all interested in nursing, because again, it's free and it's not binding. So as they're taking those first 2 years of prereqs and exploring, if they find that they're not on the right path, or they find a different opportunity, they can simply contact us and we can talk about just opening that spot up for somebody else. But it's a great way to go ahead and secure a seat in a nursing program while you're a high school senior or college freshman. So what we're looking for in that process is we're looking for a 3.0 high school GPA with a 22 ACT or a 3.2 with a 21 ACT. If they wait to transfer to us, if they're going to apply after that process, then there is a cost to apply for the program. There is an essay to write, a more traditional process. But what we're looking for when we transfer them in is at least continuing a 3.0 GPA through college. We're going to transfer anything that's a C or better, so a C- and below we won't transfer in. Or they can bring us a 2.8 to a 2.99, but they'll bring us at least a B- in anatomy and physiology if they're in that GPA range. And then they would apply through nursing CAS if they're not doing the early application process. If they're waiting until they've started taking their college classes and in the later part of their freshman year, their sophomore year, then they would actually go through nursing CAS to do the application process. Either way, students don't have to have all the prerequisites done to be able to apply. They just would have to have them all done before they start our program. So a little bit about the cost, and I referred to this 90% tuition discount earlier. We are, like I said, owned by HCA Midwest. The total typical tuition for our program is $36,000 for their junior and their senior year. So if they do that HCA loan forgiveness scholarship program where they agree to work for one of the Kansas City HCA hospitals, they're going to upfront pay 90% of that tuition. So for their junior year, they would pay $1,800, and their senior year, they would pay $1,800 for a total of $3,600. We also do have other scholarships through the Research Foundation that can be anywhere from a few $1,000s to almost a full ride. So we encourage students to apply for those scholarships first, kind of compare their options, see what's the best option for them. But students who are doing either of those scholarships, if they want to, consider looking at federal Pell Grants, Staffordized loans, those are other ways they can bring that money in as well. But this HCA Scholarship Loan Forgiveness Program is available to all of our students. There's no other criteria other than being a Research College of Nursing student. And there's no cap on how many of our students can do that program. So it's a pretty popular way to finance their junior and senior year at Research College of Nursing. We do have some ways for your students to kind of engage with us. These are two ways, but also know that as a teacher or a high school counselor, you can contact us and we would be happy to either do a virtual or could talk about coming to your school in person. Perhaps you have some college fairs that we haven't been to that we would love to connect with your students. But for your students, we have some opportunities for them to come to campus and kind of check us out and see if they feel like we're a good fit for them. So one way is Explore RCoN. That's a summer program for rising juniors and seniors in high school. So it happens every June, and there are 2 different weeks that students can choose from. And it's a 3-day experience. It's a very hands-on experience. They're going to do labs, they're going to do simulations, they're going to talk with some of our students, they're going to tour different areas of the hospital, and they're also going to get the opportunity to shadow a nurse for their entire shift on the final day of the experience. So a really immersive experience and kind of checking out what is nursing as a career like, what is Research College of Nursing like, and do I feel like this would be a good fit for me? So they can check out that information on our website on researchcollege.edu and just /explore. We typically release those dates, and we'll be sending out the save the date soon, and we'll release the applications sometime in late December, early January. They can also sign up for a one-on-one advising appointment, either in person or online via Zoom. And so they can either email Leslie or myself. And what we can do is we can talk them through that early admission process. If that's something that they would like to pursue, we can actually help them come up with a schedule for their first 2 years of their prerequisite courses. We can help them look up what school they're planning to go to, and look at which course numbers would transfer to us, and kind of walk them through and help them through that process, and just getting all their questions answered about financial aid and just the college and things like that. So just know that for your students, these are 2 opportunities that are just kind of easy ways for them to explore the college and see if they feel like Research College of Nursing is a good fit for them. We just want to thank you for taking time to learn more about the nursing pathway and Research College of Nursing, and provide you with our contact information if you have any questions about the college or those pathways to nursing. Leslie didn't brag on herself quite enough, so I'll do it, but someone with 35 years experience in admissions in nursing college, she has a lot of experience to share with students. And so she's a really great contact to help students figure out that path for themselves, or if you've got questions that you want to follow up with her on. And again, our 2 roles are really just I'm helping recruit the students. So any college visits or things that you'd like us to come to your school and visit with your students, I'm happy to help coordinate that. And then once they get into the application process, Leslie is a great resource for that. So thanks again for taking time to hear more about our school and more about nursing pathways. And we hope to talk to you and your students soon. Have a great day.